Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Brad Weaning.
Okay, Dr. Weaning, Charles Darwin said that only the fittest in the species will survive.
A daily test.
Our job is to make sure that the rest of us do okay too.
Okay.
Okay, so let's jump into our first video here.
It's PSA.
All right, can you show us the vid?
Okay, we're starting out right with the video. So this was sent in by a patient.
This is a patient of mine, very nice man, consented for us to share his woes.
Okay, so here's the video.
Okay, so this is a DIY project, and DIY happens to be one letter away from DIE.
Here he is, trimming away.
Cutting a branch.
Nice sunny day.
There goes the branch.
Oh. He's also lucky the saw didn't get him. I guess it was probably would be stopped when his finger went off the trigger, but
Gravity always acts in which direction?
straight down.
Down, right? And gravity took that branch down, which in turn took our patient down, who's probably, what, about 6 feet high there?
You mean his feet off the ground?
Yeah.
At least I think, yeah.
At least. And then he hit the ground. So what kind of injuries can happen with that?
So the first one I have to worry about is something to your spine, so your neck or your back.
Yeah, death can happen, break your neck.
For sure.
Head injury.
Yeah, concussion or a bleed.
Okay, so those sort of...
Plus you could break anything, any of your
bone, right?
extremities.
If you hit the ground with your feet first, calcaneus, ankle. If you went down with your arms first, wrist, elbow, shoulder.
Yeah, if you're straight down, tibia, femur, you could break your hip, you could dislocate your hip. There's like a million things that could happen. Just about anything could go wrong.
Okay.
Plus, whatever you fall on could puncture your abdomen, could perforate a viscus, could damage your kidney, puncture a lung, like you name it, it could probably happen.
Okay. He landed on his shoulder.
Yes.
And separated his AC joint.
Which is a miracle that that's his only injury. Like, really, that is a miracle.
So, do you think he's lucky or unlucky?
I think lucky.
Lucky.
Yeah, totally
Some
lucky.
people might say he's unlucky because he fell.
No, because he's guaranteed to get something from that fall.
Yeah.
No, he's 100% lucky.
Dealer's choice. Okay, so AC joint separation.
Okay, so what does the AC stand for?
So acromioclavicular joint.
Okay.
It's part of the shoulder joint. It's where your clavicle meets the acromion, or sort of the main bone of the shoulder.
Right, the hooked part of your scapula, your shoulder blade as it comes around.
Yeah.
Okay, is this a common injury?
This is a very common injury.
Yep.
See it in hockey players who go into the boards.
Yeah.
Soccer players that hit the ground on their shoulder.
Yeah, rugby, skiing, football, you name it. Anything where you load that shoulder in an awkward way.
Right, and so the acromioclavicular joint takes an axial load and pops up.
Right, because there are two main things that hold there. One, the capsule around the joint itself, and then a big ligament that kind of holds the collarbone down.
All right, so when the collarbone pops out, you need surgery. Don't you need surgery?
Well, so that's a good question. So first you have a sore shoulder, so you go to the ER, you go to the walk-in clinic, you go to your family doctor. Depending on the severity, sometimes you can see like a little bump there, and you're like, something is not right because I got this thing sticking way up. You have a physical exam, and then usually go to an X-ray diagnosis. We can show an X-ray here of a separated AC joint.
This is actually this patient's AC joint.
Okay, so here's his X-ray, and you can see that the two are not lined up anymore. Any other special tests before we would go on to kind of treatment stuff?
Usually it's just the physical examination where you feel tenderness and you see deformity.
Yep.
And you want to make sure the skin is intact over it.
Right. Okay, so then you get to the treatment. So everything that we talk about, we always talk about surgical versus non-surgical treatment. So can you treat this non-surgically?
I think the vast majority of the time, an AC joint injury is treated non-surgically.
Okay, so how does that start? So you're there on day one, you leave the hospital or the ER or the walk-in clinic. What do they tell you?
They're telling you to separate your AC joint and put you in a sling.
Okay.
Okay, you want to immobilize it to let the soft tissues around there heal.
Right.
And then you're going to follow up a week or two later in a clinic, probably a fracture clinic, where you're going to get a repeat X-ray, make sure everything is still in the same position.
Yep.
And then you're going to transition eventually from a sling to some gradual mobilization.
Right.
And usually I sling for at least a couple of weeks until they're a little bit more comfortable.
Yeah, so medication, ice, sling. Does wearing the sling alter the outcome of the AC joint?
No, that doesn't. Well, I mean, it doesn't. It's more for comfort.
Right, so I think it's important to recognize somebody like, I took it off when I showered, or sometimes I feel like I can't sleep with it on, or whatever. I would agree. I don't think if you compare the group of slingers versus non-slingers, that's a thing.
I don't think it is.
I don't think it is. I might have just made that up.
Yeah.
I think their long-term outcome is the same, but their degree of comfort might be different.
Right.
Yeah, okay.
So you're slinging, and then eventually you're going to get into the physiotherapy stage, where you're going to go to your physical therapist to get some mobilization going and get the strength back in again.
So long term, the non-surgical group, what happens to them? How do they? So if you saw them 6 months down the road or a year, what would they say?
Well, hopefully they're doing okay. You don't notice it, and the only thing they notice is a bump there.
Right.
Okay.
The bump's not going away. I think that's important to recognize.
That's there. That's yours to keep.
Yes.
And however, eventually you could develop arthritis in that joint.
Right. So any joint that's damaged could get arthritis. So the cartilage on the end could be damaged, and the way it rubs, so that can either have persistent pain or potentially altered function. And those would be the only reasons to ever really consider doing something.
That's right. At that point, yeah, there might be some surgical interventions at that point. Now, some people do get surgery right away.
Right.
Let's say it's really displaced or even coming through the skin.
Right.
Or punctured through some muscle.
Yep.
Well, then you might need a surgical intervention early.
Right.
Where that joint is reduced, which means put the joint back where it's supposed to be.
Yep.
Hold it there with some suture or some metal plate.
Yeah, sometimes a plate. Important to know if you get the plate has to come out. It can't just stay there permanently.
Right.
And then, you see how they do long term as well. But the majority of people have minimal pain and good function with non-operative treatment, even though you have a bump and it looks abnormal.
There you go.
It's not a cosmetic thing to have an operation.
1 minute you're trimming a tree, next minute you got a bump.
Bob's your uncle. Yeah, that's a memory, constant memory of that ladder.
Would you do that? Would you go up there and cut that branch yourself?
I don't think I would. So I have a handy little thing where I pull on this thing and then it cuts smaller branches. Really? Yeah, so it prevents me from going out. I try to avoid ladders. Every now and then I have my ladder and I think this is a horrible idea. Ladders are very dangerous. We've talked about this 1,000 times.
Yeah, there you go.
Okay, AC joint. Be careful on the ladder or maybe consider not going up. If you like this video, please like it, subscribe to our channel.
And remember, DIY is one letter away from DIE. However, I think a lot of DIY projects are pretty safe.
Sure. We'll see you next time.
You are in charge of your own health.